Hello. I'm just trying to get everything sorted on Facebook here. Happy Monday. Happy New Year. Happy 2024. All right, let's get started. I am live here on TikTok. I am live in my Hormone Society free Facebook group. That's where this conversation will live if you want to watch the replay. If you pass by on TikTok and you're like, what are we talking about? We are talking about women's health and the microbiome. It's so important if we're going to look at, arguably, if we're going to look at what the most important thing is for our hormones, it is the microbiome. And we'll talk about all the reasons why. But for those who don't know me, I'm Dr. Laura Pfeiffer. I am a naturopathic doctor. And my practice focuses on helping women's hormonal problems. So that's anything from menstrual issues to, fertility. I worked in a fertility clinic for 2 years. Lots of stuff. Essentially my largest portion of my practice is women in perimenopause. And often I'm talking about the foundational elements of hormone health. And the first foundational element is the microbiome. So I'm on Facebook here and I haven't gone live in a really long time and I don't like what this looks like. Hopefully if you are on Facebook, this is working because I don't actually know. Let's see here. There we go. Okay. So 2024, let's just get into it. What are your goals for 2024? My goal is to show up more, do more of what I love. I think when we create our goals, we need to really look at, instead of, making a resolution and, things we should stop doing. I like talking about things we should do more of. So I'd love to know if you are live in the comments, what would you like to do more of this year in 2024? What I want to do more of is show up more consistently on social media platforms and educate, because it's really what I am passionate about. I kind of dipped off for a while from social media platforms for a variety of reasons. I have 2 young children and life just got busy. So here we are, 2024. What we're talking about today, though, again, if you're just joining on TikTok live, I'm in my free Facebook group. It's called the Hormone Society. You will not be able to join right now. So if you want to stick around for this chat, just stick on my TikTok. But if you want to join for the replay or other exclusive things, head to my Facebook group, the Hormone Society. The link is where. So today we're talking about women's health and the microbiome. Why is this so important? Because I think when we're talking about the microbiome, when people hear about the microbiome, they think about digestive health, or maybe they hear about the microbiome and they're like, what are you talking about? But oftentimes those who know about it, those who have heard about it, think about gut health, right? Digestive health. And not a lot of people are making that connection between digestive health and hormonal health. So I really like to make that connection. So for anyone who's new here to this, idea, I'm going to talk about how I, as a naturopathic doctor who focuses on women's health and hormones in Ontario, Canada, how I look at digestive health. So when I talk about a lot of things, if you're a patient of mine or you've seen me before, you probably know that I talk a lot about I talk a lot with analogies rather, because I find them to be really helpful to understand a concept that maybe you've never heard of. So when we talk about digestive health, I want you to look at the gut like a garden, right? And when you're looking at your garden, most gardens have some capacity of weeds, right? Not every, unless you're an avid gardener, your garden might be perfect, right? But most gardens have some weeds. And if we were to, want to grow vegetables or want to grow flowers in said garden, we need to make sure that A, those weeds are gone, and B, that we've actually facilitated and created soil that's going to be good for those whatever you're going to grow, flowers, vegetables, fruit, whatever, I don't know. Obviously, I'm not a gardener. Whatever you want to grow, we need to make sure the soil is ready for that, okay? So if we're just coming back to the gut's like a garden. Most gardens have some sort of weeds. And so if we're continuing with this analogy, oftentimes I'm talking to my patients about if you had gut issues, taking probiotics and fiber would literally be like if you were just dumping your flower seeds or your tomato seeds or whatever you're trying to grow in that garden, if you were just dumping it on top of, soil that is questionable, right? It may or may not grow. It likely is probably not going to grow at all. And the reason for that is because you have crappy soil and you have a bunch of weeds. So it's not going to grow. It makes sense when we talk about it from the perspective of a garden, but not a lot of people think about this when we're talking about it from the perspective of your digestive health or your gut. And so what we need to do in that garden is we essentially need to dig up that soil, take out the weeds, and kind of re-nourish it and start fresh. And this is what we need to do with the digestive system, right? Most times when there are microbiome issues, so for those who don't know what the microbiome is, we're essentially made of bugs, for lack of a better term. We're just made of bugs. And the microbiome is really that ecosystem of bugs. We have a specific ecosystem on the skin, in the gut, in the mouth. Like the ecosystem changes depending on what you're looking at in the body, and that's going to dictate your health in general. The interesting thing about the microbiome, and we actually see this research continuing to grow and continuing to elevate, but what we're seeing is we're actually seeing health risks for things like weight gain. We're seeing things like obesity and diabetes. We're seeing cardiovascular disease. We're seeing PCOS, endometriosis, thyroid issues. We're seeing a lot of connections with the microbiome and with microbiome health. We know that the gut bugs that we have really dictate our health in a number of ways. So let's really connect it to women's health. First and foremost, I think it's really important to understand that in your gut, you also have an immune system. We know that women are more likely than men to get autoimmune disease. This actually comes down to our hormones. And this happens, interestingly enough, if you think about if you have an autoimmune disease, we know, well, if you have an autoimmune disease, you likely know that there is a gut or microbiome connection because a lot of patients with autoimmune diseases have been, forced to do their own research to figure out what the root causes are and how they can best support themselves on top of that conventional care, right? And so if you've looked at the connection between, autoimmune and the microbiome, we know that it exists, but why do women get autoimmune diseases more than men? One of those reasons is because we have hormonal changes that men don't have. And what I often see in practice is this, what's referred to as transitional chaos, okay? So there are times in your life where the likelihood of developing an autoimmune disease is actually elevated. And that has to do with the way in which your hormones and your immune system kind of like clash together. And so what happens essentially is puberty, pregnancy, postpartum, perimenopause, those are all areas in someone's life where you are more likely to have an autoimmune disease. Now, what happens with an autoimmune disease is you need two things. You need a genetic predisposition and you need a trigger. Okay, so obviously anyone who has that genetic predisposition, now we're waiting for a trigger. That trigger can be, giving birth, right? Being in that postpartum phase. And not a lot of people actually consider the idea that postpartum does not just mean from a live birth, right? That could be after a termination, after a miscarriage. It can be, it's just the act of getting pregnant and, ending that pregnancy causes hormonal and immune system changes that can lead to the activation of an autoimmune disease. Oftentimes, specifically in postpartum females, we end up seeing Hashimoto's thyroiditis, right? We see an autoimmune thyroid condition, and having an autoimmune thyroid condition does, again, I'm going to relate this back to the microbiome, but what I'm saying here is that women are more likely to have autoimmune diseases than men. And the reason for that has a lot to do with the hormones and the immune system and the way that they interact, but it also has a lot to do with the microbiome, because those hormones actually help to stabilize or facilitate the change in that microbiome and those gut bugs. So, if you're here on TikTok, I'm talking about the microbiome and women's health. If you want to watch this replay or watch it in its entirety, you can head to my free Facebook group because that's where it will live. You know where to find that link. Anyways, circling back. Hashimoto's thyroiditis is an autoimmune disease. We know that having antibodies to the thyroid is actually an independent predictor for miscarriage risk. So again, if we're looking at the implications of these things, looking at the autoimmune piece of women's health is huge. I know I kind of went on a little bit of a tangent there, but essentially there are a lot of things that happen during transitional chaos, as I've just referred to it as. So like I said, puberty, postpartum, perimenopause, or I guess like puberty, pregnancy, postpartum, perimenopause. But anyways, there's a lot of things that happen with that transitional chaos. And one of those things that happen is that your microbiome changes. So did you know that specifically when you go through perimenopause, a lot of people know that your estrogen changes, but they didn't know, or most people don't know, that your microbiome also changes with your estrogen, because your estrogen is actually part of maintaining that microbiome. So for example, if we're talking about urinary or vaginal health, right? Typically, one of the symptoms in perimenopause is dryness or increased urinary tract infections or UTIs. And one of the reasons for that is obviously the drop in estrogen. But with that drop in estrogen, we actually see a change in the types of bugs that are present in both the urethra and the vaginal areas. And those actually protect from infections. And again, we come back to the microbiome. So yeast infections, UTIs also increase as you're heading through perimenopause. And so one of the signals for me, we're not just talking about perimenopause here, we're talking about all women's health, but one of the signals for me that a patient has microbiome issues is frequent UTIs, frequent yeast infections, right? So looking at that, because we know a certain microbiome has to be there in order to facilitate healthy bugs all around. And we know that it's all about the balance of those bugs. If we look at pregnancy and fertility, we know that the uterus and the vaginal canal should have an abundance of specifically lactobacillus bugs. If they do not, we know that actually having those bugs increases the chances of getting pregnant, staying pregnant, having a healthy baby. We know that. And we know that having bad bugs there can actually influence implantation and other things in a really negative way. So when it comes to pregnancy, we know that the microbiome is really, really important. When it comes to conditions like endometriosis, I always like to talk about this study. Now, this study was done in animals. It was not done in humans, so that's important to understand. However, I just find it interesting. So what they did is they had two groups of, I believe it was mice or rats. I haven't read the study itself in a while, but basically what they did is they created two endometriosis models. So two groups, endometriosis, and what they did is they gave one group antibiotics to basically essentially wipe out all of the bugs. So wipe out the microbiome in its entirety, okay? And what they found is that the endometriosis actually regressed and went away in the group that they gave the antibiotics to. Why? Because there are certain bugs, certain microbiome that have an association with the growth of endometriosis. Now, have we been able to prove this in humans? Have we been able to say antibiotics can cure your endometriosis? No, because if that were the case, people would not be struggling with endometriosis. My point is there is a connection between the gut bugs you have and endometriosis. Now, if we look at endometriosis specifically, we can look at it as partly an autoimmune disease. And so coming back to autoimmune diseases, the reason I look at it, and a lot of people actually now are starting to look at it as an autoimmune disease, is that with endometriosis, we essentially have uterine tissue that's growing outside of the uterus. And the really big question that you have to ask is, why is the body not controlling it, right? So oftentimes if there's something that's kind of out of the ordinary or out of whack in the immune system, in the body, the immune system will come up and essentially sweep it up and clean it up, right? That's what we do with wounds. If we have an injury, essentially, the body comes and cleans it up, and that's that, right? But with endometriosis, we see things growing where they're not supposed to grow, and no one is cleaning it up, right? And so essentially there is a little bit of immune dysfunction there when we look at endometriosis. On top of that, we know that there is research saying that gut bugs may not actually start endometriosis, but they certainly fuel it. So we do know that when we look at stool samples of people with endometriosis, there is a specific profile of gut bugs. We also know that the same thing happens in like thyroid, autoimmune. If someone has Hashimoto's, we know there are specific gut bugs associated with having thyroid antibodies. With PCOS, same thing, right? And so what we're seeing is patterns of women's health conditions that are associated with certain changes in the microbiome. So that's really the point I wanted to drive home here before kind of moving on to the next piece of what I'm going to say. And so for me, if a patient comes to see me and they have PCOS, to me, that is evidence of microbiome dysfunction. Now, do they necessarily have digestive issues? The answer is kind of complex, because I find that, the reality is you only know your own experience, especially when it comes to digestion. We're not, often looking at other people's digestive function unless we have kids, in which case it's different than ours, right? A lot of times I'm talking with my patients about how the majority of the population is constipated, and my patients laugh and they're like, no, I go all the time. I'm like, no, you are constipated. No one believes me until we start doing some work and they're like, oh yeah, no, I was super constipated. And the reason is people don't really understand constipation. And so kind of circling back to the microbiome in women's health, the question is do you have a microbiome issue? Well, if there is an autoimmune condition, a thyroid condition, PCOS, endometriosis, just to start, the answer is yes, because we already know that people who experience those conditions have a specific microbiome profile, and oftentimes it's dysregulated. If there are UTIs and yeast infections, yes. A lot of people will circle back to, but my digestion's fine. My digestion's fine, so my microbiome's fine. And again, my question is it though? Because like I said, the majority of the population, in my opinion, is constipated. And so let's talk about what healthy digestion looks like. When we're talking about the microbiome, what does healthy digestion look like? I find more often than not, I'm coming across people who are like, no, I literally go all the time. I go after every single meal. Every time I eat, it's like a joke in my family that I have to go to the bathroom every single time I have a meal. And honestly, 9 times out of 10, constipation. Why? Because if we are looking at it, if we're just literally looking at your digestive system like a big long tube, and we are starting to put things in that tube, at some point, it's going to come out the other end of the tube. Now, if that tube is extremely full, every time we put anything in at the top, it's going to come out the bottom, right? And so we have to really look at it like that, for really lack of a better term, that when we start filling that tube, it's going to come out. So these are the people that I talk to where they're like, no, I literally, after every meal, I take a poop. And it's like, well, you have a full tube. And so every time we push something through that tube, it's like coming out the end, little bit. And it's not until people actually go, a full, complete bowel movement, they're like, oh, that's what that is. Because I've talked to patients, they're like, no, I'm fully evacuated. I feel great after a bowel movement. But you just don't know what you don't know. So it's really good to be informed on this. And like I said, evidence, if you're like, I think I have good bowels, but then you have autoimmune disease, well, huge deal, right? We need to deal with it. And so coming back to kind of my garden analogy, when we're talking about the microbiome and the garden and the growing of weeds, like this is the whole thing, right? So we need to de-weed the area. So what does that really mean, like tangibly? It depends. If I am with a patient and, they have XYZ, say they're constipated, they to their definition, they are constipated, meaning they go like, once every other day or every 3 days. Now, someone's going to be listening to this being like, wait, every other day is my normal. That's always been my normal. I feel great. You are constipated. Right? And so we need to be going the normal definition of, actually, you know what? I feel like it's not even the definition, because a lot of times we take averages of what the population's doing and we kind of pull from that. I don't think that is something that we should be doing, but essentially, bowel movements need to happen daily. Now, in my opinion, as a practitioner, they do not need to be happening like 3 times a day in order for it to be, normal and sufficient. You just need to be going enough that you are completely evacuated and there's no other concerns, right? So anyways, fully evacuated every single day, no blood, mucus, or undigested food. Really, bloating shouldn't be there. Heartburn shouldn't be there. When we're taking heartburn medications and don't have heartburn because we're taking heartburn medications, obviously that means something's off, right? Now the question I always get is, but like, what is there, right? Like, do I have candida? Do I have H. pylori? Do I have, a parasite? Everybody has a parasite these days, allegedly. The answer is I truly don't know. Why? So in my practice, I actually do a stool test. It's called a GI map. It's a PCR test that looks at a lot of things in your stool. So it will look at viruses, parasites, bacteria. It specifically breaks down H. pylori, looks at stomach acid. Like, I could go on and on. It looks at a lot of different things. Now, over, I've been doing this specific test for probably 5+ years. And what I find when I look at patterns of the results is I find that there's no specific, now there are exceptions to this, but I found in my patients a lot of the time the presentation is different than what's going on in the gut. And what I mean by this is, like, I could have 5 patients lined up and they all have, H. pylori, but one of them's constipated. One of them's main complaint is heartburn. One of them's having loose stool. One of them, is just so bloated. And I find that that's because there's a compilation of things going on, right? If we look at the microbiome is more of a community than anything else. And so if we're looking at that community and how that community behaves, it's not just one thing that's driving that community, right? Even if there is candida, oftentimes it's like, well, there's also H. pylori, and there's also strep overgrown, and there's also pseudomonas, and maybe this person has more biofilms, right? And we'll talk about what that looks like, but essentially, it's just the bigger picture. We can't look at things so specifically and, so one by one. The amount of people I talk to that are like, I'm doing an anti-candida diet. I don't agree with those. And the reason why is because if we're doing something like an anti-candida diet, even if you had candida overgrown, found in your test, it's like, okay, but, we take away everything candida feeds on. So that's literally all sugar, good and bad. So it's not like we're creating a diet that's sustainable or realistic at all in any way, shape, or form. What we're doing is taking away any potential source that the candida can live. Now, compliance on this is so low. You will be hard pressed. I'm hard pressed to get most patients to do it, and I actually don't recommend it. Why? Because if we take away the sugars, the vinegars, the bread, like the fruit, like literally everything that candida is allegedly going to feed on, eventually we're going to have a fruit. Eventually we're going to have something with vinegar or something that's fermented, and it's not going away. It's just going to grow back up. So you're going to get it down to a level that it probably feels, you're like, my symptoms are better. My bloating is gone. Now you're stuck in a place where you literally eat nothing. And now, once you stop eating nothing, things are going to just come back. What I prefer to do is actually just kill off the candida. Right? I like to do a kill off of anything that's there, whether it's H. pylori, candida, strep, literally anything else, parasites. I want to kill it off. I don't want to just, try to starve it off by limiting your diet. Same thing with like a low FODMAP diet can be really effective in IBS and SIBO, but I just personally, from my practice, don't see the compliance being well, number one. And number two, once you come off of that low FODMAP diet, you feel crappy. You feel just as crappy as you felt right before. And so you have two options. You either stay on an extremely restrictive diet for the rest of your days on earth, or you fix the problem, right? And you actually kill off the stuff that's there. So how do you kill off persistent infections? It depends, right? So a lot of times I find that there are biofilms. And biofilms, if we essentially look at biofilms as communities of bugs. So essentially, like, bugs are trying to survive just as much as we are, right? If we think about plaque on your teeth, this is why getting your dental health dealt with is so important. For example, we know that people who have H. pylori infections in their gut and they don't get dental care, a lot of the times they have H. pylori in the plaque in their teeth, and then they're just swallowing it, right? So it's really important to get proper dental care, but we know that plaque on your teeth is a biofilm. And so if we think about, algae on the side of a boat or in the water, we think about plaque on the teeth. This is biofilms. This is a community of bugs that are just trying to survive, right? And so biofilms, from the research, become more antibiotic resistant. They are just creating a community so that they can become essentially a lot more resilient, right? And so what we need to do is, in a lot of my patients, depending on what the concern is, I'm cycling through a lot of antimicrobials, and I might do that for 6 months or longer. But the thing is essentially you don't want to keep using the same antimicrobials. Like, let's say we're using something like oregano or garlic or something of that nature. We need to make sure that we're cycling through, and maybe I'll do, one treatment cycle for 4 weeks and I'll do another treatment cycle. But you also have to know what to look for, right? Some people get flare-ups of whatever's going on. It's so important to be monitored during treatments like this, right? We don't want to just go rogue because you don't know, how long you're going to be doing it for and what to expect. And what do you do if things kind of fly off the handle? What do you do if you have, let's say you have eczema, you have allergies, and you have gut stuff, and you're like, I'm doing like my stool test said this came up, I'm doing antimicrobials, and then your eczema flares up. What do, right? Do you pull back or do you go harder? Depends, right? Like, it depends on my patient. That will determine what I'm going to do next. But my point is we have to look at, the bigger picture of potentially biofilms as well. Specifically, I see this in people who are on, like, if we look at the birth control conversation, people who are on like the NuvaRing, which is, for those who don't know, it's like a silicone ring that you insert for 3 weeks out of the month and then you take it out. And so that is actually how the birth control works. It's hormones delivered locally. I see a lot of yeast infections, chronic yeast infections with people on the NuvaRing. Again, because there's something there that's going to be essentially ready to harbor a biofilm if it needs to, right? Essentially, they're changing the microbiome if it needs to. And so I see that with the NuvaRing. Sometimes I see chronic gut stuff in people with IUDs, right? If we look at, bladder meshes and IUDs and any other implant that's somewhere in an environment that's moist, we give the ability for bugs to grow where they don't want to. And then, lots of people talk about inflammation, joint pain, inflammation leads to this, and it does, but where does most of the inflammation come? From the gut. A lot of gut bugs, specifically if we are killing off gut bugs, sometimes what we do is we open them up and they will release inflammatory mediators and cause us acute inflammation. So it's important to look at those things, but again, inflammation can impact your hormones as well. Not only does the gut influence, your hormones directly by a number of mechanisms, but it's also going to impact the ability to recycle and get rid of your hormones, right? We know that certain gut bugs make something called beta-glucuronidase, which will dictate our hormone recycling, specifically our estrogen recycling. So estrogen has to go through the liver, through the gut, and out, right? And so if we think about it, if we are, I don't know why people keep asking to join the live. If we are constipated, how are you recycling your estrogen, right? A lot of people talk about estrogen detox and all of this detox, but they're not pooping. It's like, okay, well, you can't really efficiently detox if you are not pooping. So that's the other piece. And then we look at, the question about persistent infections. If it's not going away, why, right? And so the biggest thing I like to look at is so again, we're circling back, we're coming back to the garden analogy of the microbiome. And with that garden, we have the weeds and we have the contents of the garden, right? We're trying to grow good, essentially flowers. But in this case, it's like good bugs and a good, healthy, balanced community. Well, what happens to a garden that you're growing vegetables in? Oftentimes, animals get in there, right? And so what happens when animals get in there? Animals will eat your food, right? So how do we keep the animals out? A lot of times we can build a fence. And so if we come back to the gut, what is that fence? Essentially, the fence that protects your gut is going to be stomach acid and immune system. And so if any of those features are down, essentially your security system is gone from your gut. And so with my patients, I always say, two people will go to a restaurant and they'll get food poisoning. And it's like, well, what was the difference between those two people who got food poisoning? What was the difference? One person went in, ate the same meal as the other person, and only one person got sick. I like to look at that as something called the terrain theory, right? It wasn't about the specific food. Now, again, this is just in my example. Some gut infections will impact any terrain, but if, one person gets food poisoning and the other person who ate the exact same thing doesn't get food poisoning, the question is why? And it's because one person had a stronger terrain, right? So potentially they had gut bugs that were less likely to get disrupted, or they were more likely to have a protective effect against infection. I actually shared so if you're on here on TikTok, you can join the Hormone Society free Facebook group. This is where this will be posted and will live if you want to take a look at the replay if you've just joined. But we're talking about women's health and the microbiome. But there is a article. It was a recent study from the University of Oxford found that having a variety of different bacteria in our guts help protect against harmful infections. When researchers tested individual types of gut bacteria, they actually weren't very good at stopping the growth of harmful bacteria. However, when they combined up to 50 types of bacteria together, they saw a significant decrease in the growth of harmful bacteria. This protective effect occurred both in lab conditions and in mice without any gut bacteria to start with. The key finding was that it's not just about having many different types of bacteria. Specific types within the community play a crucial role in protection. These protective bacterial communities prevent harmful bacteria growing in a number of reasons. So one of the ways they do this is they use up the nutrients that the harmful bacteria need. And so that's just one way that we protect against infection. So again, walking us back to the food poisoning conversation. Two people walk into a restaurant, they eat the same thing. One person gets sick, one person doesn't. Why? Because, okay, stop asking to join the live, please. One person gets sick, one person does not. And one of the reasons is it comes down to the terrain. The one person's terrain is better. They have either, one or more of the above. But the things that protect us from getting sick, essentially, food poisoning is a good, solid microbiome community in the gut. Number 2 is stomach acid levels that are going to protect against bugs. So we keep our stomach acid in our gut at a certain level that will actually protect against overgrowth. So when we don't have, enough stomach acid, we are going to be more likely to have certain overgrowth. So that's the first and the main thing. Certain bugs cannot live at a certain level. And then it comes back always to my conversation about proton pump inhibitors. So proton pump inhibitors are medications given essentially for heartburn. It will be kind of your first line treatment. I don't love them. And I know as a naturopathic doctor, a lot of people would jump and say, well, you don't love any medication. No, I do. I actually like a lot of medication. I think there's a time and there's a place. And proton pump inhibitors, I have hard time finding both a time and a place. Because one of the things they do is they just turn off your stomach acid production completely, which, like I just said, we do need stomach acid in order to protect our gut against infections. Further, we need stomach acid to break down everything we eat so we can actually absorb it. We need it to absorb nutrients. We need stomach acid for a variety of reasons. So I don't love the medication because it takes away essentially our main way for absorbing nutrients and all of those pieces. So don't love it because it's one of our defenses. And again, if we're looking at the whole picture, we also know the research of proton pump inhibitors is not great. We know it increases the risk of C. difficile. We know that it decreases B12 absorption. We know it increases the risk of osteoporosis and fractures long term. Yes, I'm on a PPI. I think it's causing issues. What's an alternative? I don't like to talk about alternatives because it's not essentially an alternative. What we have to do is figure out why you have heartburn in the first place, right? So is it because you have low stomach acid? Now that sounds counterintuitive because a lot of times, a lot of people don't realize that you need stomach acid to actually shut the flap between the stomach and the esophagus. And so if you have low stomach acid, you're not only is food going to sit around and not be broken down and not be absorbed and digested, but that flap is going to be open because we have not sufficiently closed it and things are going to just slosh up, right? And so that could be the reason why the heartburn is happening in that particular example. Other examples, someone could have H. pylori. So H. pylori infection can be a reason for heartburn. Some people have valve dysfunction, which again, that's another reason we need to figure out alternative solutions and modify the diet in a way that makes sense. So it is truly individualized. We're not, and I talk about this as green allopathy, right? So I'm a naturopathic doctor. My goal is to get to the root cause of what's going on and kind of give a plan based on that. But when we see naturopathic doctors practicing like green allopaths, what that means is we're essentially swapping out like, don't take your proton pump inhibitor, but take this supplement instead. Or, don't take your antidepressant, but take St. John's wort instead, which P.S. I would not recommend. I'm not recommending that. I'm just saying that's not the way forward, right? So what we need to do in the case of someone being on a proton pump inhibitor, what I personally do with my patients one-to-one is I will have a conversation with them about talking to their doctor who prescribed it, talk to the prescribing physician about weaning off that. And at that same time, we fix what the problem is, right? So if the problem was a diet thing, if the problem was a low stomach acid thing, if the problem was an H. pylori infection or something else that was causing the heartburn, then we know, were they eating too late at night? Were they having, lots of spicy food and that was a trigger for them, right? How do we modify the diet? But just, I like to educate my patients that it's about 80% of people who come off of a proton pump inhibitor will have heartburn as a rebound effect. So the heartburn will actually happen because of coming off. And so a lot of my patients will start to come off and say, oh, no, I have heartburn, I'm not coming off. But they don't realize that coming off was actually going to cause heartburn either way. And so understanding how to wean off really takes guidance, right? So that's kind of the conversation of the microbiome. And she said, I get rebound just if I forget a dose. Absolutely. Yep, you will. So it's about deciding like, how do we, you definitely don't want to, as a practitioner, I personally don't do things that pull the rug out from under people. I don't like to do things, that are going to take everything away. Like, day one, you have digestive issues, you have heartburn, you're on a PPI, you're on birth control, and I'm like, stop everything. Like, I would just never do that because pulling the rug out from under someone does not help them at all, right? So that's not my first move, but oftentimes I will say, okay, let's figure out what the priority is here. And so if I think that your proton pump inhibitor is stopping your digestive system from doing what it needs to do, certainly I'll say, okay, let's decide who we're going to talk to about weaning off, how we're going to wean off, and what we're going to do in the interim. Sometimes, again, it depends on the patient, depends on their risk factors, it depends on everything else. But with some patients, I'll say, let's try, get whatever over the counter helps you with your heartburn. while we're weaning off, right? If we can wean off and just get over that hump, sometimes that's enough for my patients, right? So it depends on what they're presenting with. But if they're like, you know what, Tums or Rolaids really helps me or has helped me in the past, I might say stock up on Tums or Rolaids and like let's go, right? But it depends on what they're struggling with, what their risk factors are, everything else. Like sometimes patients are on it because their doctor has told them that they are, getting Barrett's esophagus and they need to be on it. And then we can have a deeper conversation about the research on that in that particular case. But sometimes I'm saying, you know what, this is going to be a hindrance because what we're going to do is we're going to eradicate. So we've done a stool test. Let's just say hypothetically, we see overgrowth. We're going to get rid of it. Well, now we have no fence to put back up if we cannot get the stomach acid to go where it needs to go. So that's going to be a problem, and that's going to be a barrier, and that can be a reason for chronic gut infections because we're consistently keeping the acid levels down, the stomach acid level production down. So that's not going to be good for preventing overgrowth. So it's been lovely. I've been about 40 minutes here, so I'm going to wrap it up. But I wanted to just make that conversation clear. If you want to see this from the beginning, you can head to, you know where the link is. And you can head to my free group, the Hormone Society, to learn about that and more. And also feel free to come in and ask your questions. Thanks for joining me today. It's been a lovely chat. Happy New Year. Hopefully everybody has their intentions set for the year. And I will talk to you soon. Bye.